John Shinholser, president and co-founder of the McShin Foundation here in Richmond, Virginia. More important, a person in long-term recovery from substance use disorder. I've been clean and sober a little over 35 years. And me and my friends noticed back in the late 80s, as our drug laws started changing and services for addiction and alcoholism were diminishing, we were thinking to ourselves, you know what, America can't build enough jails and prisons. And there's just not going to be enough capacity for the people who need help. So what we're experiencing today in 2017, we knew way back when. Of course, we're just in recovery trying to get our life straight, become useful, productive members of society. You know, we leave it up to the professionals, the politicians, the bureaucrats to make sure that we have good services for our future folks need them. But what happened was special interest groups got hold of our systems and we created the world's largest industrial prison complex. We have a huge criminal justice system. And there seems to be very little desire to change things. And there's a lot of reasons for this, a lot of depth to our current problems. But so we started advocating back in 1999 to get more funding for services, especially for those asking for help the same day. And that seems to be a problem. We have addicts and alcoholics. Everybody knew for decades that when a person asks for help, you give that person the help that day. You don't wait, you don't tell them to come back later. They don't come back and they create worse problems.
I have a question.
Go ahead.
So we know that the rates of incarceration, like over 70% of people that are in our prison system are there for drugs.
Correct.
Do they not care, or do they not believe in the disease of addiction? Because we also know that incarceration, they go back out and use.
Well, the number one thing America is doing wrong, the main thing they're not doing right, they're not helping addicts and alcoholics, people suffering from substance use disorders, family members reaching out for help for their loved ones. We don't have a system in America to help these people. Our current system is the criminal justice system. It's the instant arrest, or the emergency room, or the death, and then you get in a whole nother set of problems. So we started advocating in 1999. We were trying to get more funding for better services in Virginia, the state of Virginia. And what happened was we did get a little money for the state. And what we discovered that the state and the local providers, the money we were getting them, they were just using it up on jobs, not on services to meet the needs of the consumer. And the main need is helping the consumer when they need it and when they ask for it. So that's how McShin Foundation really got started. So I started asking around, how do we get reimbursed for, when we take somebody off the street that came to us to ask for help, we put them in a sober home, we put them in a recovery center, we put them in front of an addiction doctor the same day, we pay the bill. How do we get reimbursed for that? Knowing that we just saved the taxpayers thousands of dollars so they didn't have to get arrested and go through the criminal justice system or the emergency room. And I kept going back to the same place, the same answers. And that was a place called the Community Service Boards. Community Service Boards, what I come to find out, there's 40 local boards in Virginia. Community Service Boards, CSB. There's 40 of them in Virginia. And they get a piece of money from the state. They get about $42 million. That money changes from time to time. And then they get $42 million, you know, give or take $1 million or $2 million, from the federal government, an organization called SAMHSA, the Substance Abuse Mental Health Services Administration. And then the localities, they pump in a little extra money. I don't know how you want to add it all up. Sometimes you can read a report saying there's $136 million a year being spent in the state of Virginia. Some say it's $142 million. Some say $128 million. Nobody really knows the exact number on what kind of money is being spent on people needing help in Virginia. But one thing's for sure, the money being spent equals government jobs. It doesn't equal recovery. And if anybody knows anything about addiction or substance use disorders, we know that the solution is recovery. So we should have systems designed to provide instant recovery, not delayed recovery. So all this money equals what I'm going to call government jobs. not recovery. So I started going to each of these entities, the CSBs, the state General Assembly lawmakers, and this is what I found out. There's an organization in Washington called SAMHSA. SAMHSA is part of Health and Human Services Administration. That's like a secretary position, like you got Secretary of Defense, Secretary of Navy, Secretary of Education, Secretary of War, Secretary of a lot of things, but Secretary of Health and Human Services, these are, the president appoints these secretaries. And these secretaries, underneath them is SAMHSA, of which they give their little piece of money to the states, we'll say Virginia. Every state gets their piece from SAMHSA, and then Virginia sends it down to the CSBs. And I kept asking these people, why don't y'all spend money on helping addicts and alcoholics the day they ask for? Why don't we have a system designed for that? And that's a good question. I don't know why they don't do that. The only thing I can think of, they're feeders for the criminal justice system. That's the only thing I can really come up with. And I'm not saying stop all your existing programs, but what I am saying is this: you should provide same day, absolutely same day access to sober living, to recovery organizations, to medication-assisted detox. That day, don't send them back out in the community so they can risk dying, going to jail, or ending up in the ER room. You're not doing anybody any favors by creating barriers to people asking for help. And any doctor worth their salt, which many aren't, but some are, especially years ago, the American Society of Addiction Medicine, ASAM doctors and members, they all knew that when an addict or an alcoholic asked for help, that was the main point of entry for successful outcomes. Those that were open-minded asking for help. They knew that the main barrier to help was denial. People not asking for help, not recognizing they got a problem. So when we get a population asking for help, recognizing they got a problem, that's to catch me out. That's when we're going to get our best outcome, and we are defying that. And that's what we need to change.